I can conveniently pay for my utility bills, my son's Cartoon Network on DSTV, and renew my internet services package. I can securely send my sweet mother her monthly allowance by simply transferring funds from my bond account into hers. I can also pay the gardener through any of the mobile money platforms available. I can verify if the check to the vendor has cleared. Now let me guess my sister is here at time so I can peacefully go back to sleep. With Bond Mobile app, you can do your banking anywhere. Download the Bond Mobile app on Apple Play Store or Google Play Store today. Bond, your success, our passion.
The National Science and Maths Quiz is the longest-running independent production on television. It's the one program that brings education authorities, teachers, allied staff, students, old students associations, and parents together in support of science education at the senior high school rank of the education ladder. The objectives of the National Science and Maths Quiz are to promote the study of the sciences and mathematics, to help senior high school students develop quick thinking skills and a probing and scientific mind about things around them, to promote healthy academic rivalry between senior high schools, to a lesser degree, keep old students still interested in their schools and encourage them to offer help to their alma mater, to inculcate a degree of science culture in the Ghanaian society for all to see science as a way of life. Let's take a walk down memory lane and see how far we have come in 25 years. The idea was not proposed at a national science fair or conference, but rather on the tennis court of the University of Ghana, Legon, where Mr. Kweku Mensah Bonsu, then managing director of Primetime, was at the court to play the game after his own heart with his playmate, the late Professor Ebenezer Kweku Awotwe, Professor of Animal Science. Mr. Mensah Bonsu was curious as to why birds could stand on a live electric wire without getting electrocuted, but human beings could not do so. From Professor Kweku Awotwe's explanation, Mr. Mensah Bonsu got the idea of a quiz program focused on scientific explanations behind everyday phenomena, in addition to the topics from the regular science curriculum for senior high schools. Thus, it all began 25 years ago, in April 1993. Since then, the National Science and Maths Quiz (Nsmq) has seen 22 exciting editions.
Selecting the quiz mistress and the gender was entirely my decision. So one Saturday evening after tennis, we were sitting in Commonwealth Hall senior common room, and then Marianne was there. So I just said, he said, you talk to Marianne. Have you spoken with her? I said, no, I'm going to talk to her. So I talked to Marianne. Then Dr. Marianne Addy, later Professor Marianne Addy. I told her about the program and that I needed a quiz mistress. I wanted a quiz mistress. And she said, but why me? I said, you, because you are a female scientist with a PhD. Can you imagine the impact that this would have on the children, especially the girls? That I want you to be the quiz mistress, whether you like it or not. In fact, I've selected you as a quiz mistress. And she had a good laugh. I said, okay, I'll do it. And then when Marianne was leaving the program after 7 years, and this she recommended Eureka MFA Adumako. And the first time I met her, I said, well, of course, if you're called Eureka, that's a name that came out of mathematics. So then you are our quiz mistress. I met Dr. Kaufman at a program, and she and Professor Alote came to my office to talk to me about some mathematics competition or science, international science competition. And I went and talked to Dr. Aotwe. I've met her only once, but I think from the way she spoke and the way she carried herself. And Aotwe said, well, strangely, that's the person I was also thinking about. So I said, well, your job is cut out for you now. Our 3 quiz mistresses have all been great, I must say.
There would have been no excitement without very interesting and well-crafted questions. The nature of the competition requires that questions be of equal strength and difficulty at each stage of the competition. A team of consultants were selected to work on the questions. This is how the team was put together.
Then I got my friend Dr. Adanu, to do the physics. So Asmeni for chemistry, Adanu for physics. Then for biology, Aotwe himself, Mrs. Kwaku. She put together a team to do the maths. Now, beyond the first year of the competition, I got to know Dr. Douglas Edujemfi of the maths department. And Douglas agreed to be a part of the team. And since then, he's been a part.
The program was first recorded in October 1993 with the late Professor Marian Irama Ade, Professor of Biochemistry at the University of Ghana, Legon, as the quiz mistress. It was originally named the Brilliant Science and Maths.
Good morning, ladies and gentlemen, and welcome to another one of our mentorship sessions for the 2018 National Science and Maths Quiz. The mentorship sessions are geared at, yes, inspiring our students and contestants, but again, averting their minds to other areas in the sciences that they may not have thought about. Our mentor for this morning is Professor Efia Hesse. Professor Efia Ejo Jekte Hesse is a pediatrician, is a pediatric surgeon, medical educator, and hospital administrator with over 37 years of experience in her work in both the UK and Ghana. Professor Hesse obtained her MB CHB in 1976 at the University of Ghana Medical School in Accra, became a fellow of the Royal College of Surgeons in Edinburgh in 1983, and was a fellow of the West African College of Surgeons in 1990, and is a foundation fellow of the Ghana College of Surgeons 2005. She has a certificate in health management administration for senior health practitioners from GIMPA 2005, and a certificate in health management, planning and policy from Leeds, as well as the level 8 diploma of the Chartered Management Institute in London. She has participated in many workshops and conferences in the field of medicine and pediatric surgery. Our mentor this morning is a woman of many firsts. She was the first female pediatric surgeon in Ghana, as well as the first woman surgeon from her alma mater, and recently served as the president of the Medical Women's International Association, another first for Ghana, for a Ghanaian in the 91-year history, of the association, which is the first international professional women's association. She is currently the president of the Accra College of Medicine, Ghana's leading private university. Professor Hesse is married with 4 children and 7 grandchildren, and her hobbies are reading, cordon bleu, cooking, and singing and counseling. Ladies and gentlemen, help me welcome Professor Efia Hesse. A round of applause.
Good morning. How are you? I'm sure you're looking forward to your schools competing and seeing what's going to happen, right? I just want to come and share a few thoughts with you about life. Is that okay? You know, how many of you have had dreams about what you would like to become in future? I mean, from the time when you were little to right now. How many of you have had dreams about what you would like to become? Just show by hand. Oh, it looks like not many of you dream. Is that so? You don't dream. Or you don't believe your dreams can come true. Is that what it is? You know, God puts in us ideas about the pathway He wants us to follow through dreams. You remember some of the dreams in the Bible? Joseph had a dream which ultimately caused jealousy, which took him one way, but God had intended him to follow that route. I believe that God puts ideas in our heads. He does not force us, but He puts these desires in our minds as to what we could become. And there's no limit to what it is that you can become. How many of you believe that? How many of you think that the present day difficulties in your home, in your background, will put a limitation to the dreams that you can realize? How many of you think that? You must never let current circumstances stop you from achieving the dreams that you want to achieve. I remember when I was very little, my parents told me I said I was going to become a pediatric surgeon at 4 years of age. I didn't know what a pediatric surgeon was, but I knew I wanted to be in medicine. And that was when I was 4. And I held on to that dream to make it the reality that happened for my working life. You know, when you're thinking about what could become of you in future, you must remember that you are choosing a pathway where you're going to be spending minimum of 25 years, sometimes 40 years of your working active life. So if you find yourself in the wrong profession, can you imagine something you absolutely did not really want to do? But that is where you have found yourself. Every morning you wake up and you think, I'm going to go back to that place again. There could be no worse torture for you than have that happen. So when you're dreaming and God is giving you these ideas, you must be willing to take these big, hairy, audacious dreams and with the help of God, make them happen and make it a reality. Most of you will go to university and you'll finish your first degree, you'll be aged 22, 25, and you're going to be spending all that time until you retire. If you're in the public service, compulsorily at 60. So how are you going to achieve these dreams? One is you must be persistent. Persistent. That means you must keep at it. You must not be easily discouraged. You must not give up. There are many things that will make you give up. Sometimes when you talk to somebody and tell them, they'll laugh at you, your friends. They'll laugh at you. Oh, you want to do what? You want to go to the moon in Ghana? But if that is your dream, why not? Science is advancing so fast. By the time you finish your university, your first, your second degree, things will be so much better in the country. There will be an aerospace program set up, which because you have positioned yourself in the right place at the right time, you will be the one to lead it and you will determine who from Ghana will be going to space. But if you let somebody's thoughts discourage you, you will not even set off. You must persevere. You must keep at it, even when you fail. Failing is when you don't keep going. Not passing an exam is not a big deal. I remember when I was at the University of Ghana, this was in 1971, first semester. In those days, we had semesters, trimester, not semesters. But I had some personal tragedies. I lost my father first semester. He was only 50 when he died. And it looked as if it might have been the end of the road for me. So that first semester, I remember I failed chemistry at the university level. Now, up till then, from my time in secondary school, I had never ever failed an exam. So you can imagine how devastated I was. But the thing about it is, failure can happen. You pull yourself up by your bootstraps, and you try again, and you work harder, and you make it, and you move on. It is when you give up trying that you have failed. Because by doing exactly that, by the time we finished the whole medical program, I, who had failed first year chemistry, was the one who was awarded the gold prize for the best student in my medical class. But if you give up, those things will not happen. So determination, perseverance. Don't be put off by challenges, and especially the ladies. When you say you want to do the science and the medicine, and they say, oh, if you go into medicine, nobody will want to marry you, you won't be able to have children. They still say it even in this day and age. A young lady doctor came to see me, and she was telling me she wanted some advice and mentoring. She wanted to do surgery, but people were saying she won't get married, she won't have a family. Now, at the time I did my training in surgery, there were no women surgeons in Ghana. And surgery had been known as a male-dominated specialty. But if you let things that people say determine where you are going, you will never be able to achieve anything. Because now, by God's grace, I got married, I have 4 children. Since me, there are now, let's say about 10 women surgeons in the country. Some of them are venturing into specialties where there have been no women at all, surgeons. Some are becoming urologists. You know what a urologist is? We call them the waterworks. They look after the plumbing, the kidneys, the bladder, and everything to do with the water in the body. And for a female to go into that field, she'll be dealing mainly with male patients. Just as it's been all right to have gynecologists and obstetricians be male who are looking after females, so also it's all right for a female surgeon to be looking after males. Don't let anybody discourage you. And most of these women surgeons have families. They have children. So that myth has been thoroughly broken. So there's no excuse for the women anymore. There's no excuse. You must be prepared to work hard. You must be prepared to work hard. That means that when people are going to watch football or going on the park to play or maybe going to the pub to have a drink, you will go on with what you need to do to help you get where you need to go. You millennials and Generation Z, you are Generation Z, you are in the internet age. But I feel saddened that a lot of you are not availing yourself of the opportunities that this internet age brings. There's so much information you can get from the web. It will help you to read wider than what it is you are being taught at the moment, to broaden your horizons, to see what is happening in other places. And all of that is available to you at the click of a button on your phones, if only you would use that opportunity. You must realize that problems will come your way, challenges will arise. But the thing about the challenge is finding how to overcome it. And I say problems are solutions that are waiting to be found. So make yourself the person who identifies problems and looks and finds solutions for these problems. You will be the one who everybody will see as different. And when they are looking for a different person, a problem solver, you are the one they are going to come after. They are going to headhunt you. They will come and ask you, we see you're doing so well, you've been able to solve the problems here. Can you come and help solve problems in another place by virtue of a position you've been given? And that is what happened to me. I was made head of department of surgery at the medical school, and I was doing my bit of solving problems in the department. And then the board chairman calls me and says, there's a vacancy in administration. We are impressed by what you've been doing in your department. Can you consider coming to the administration of the hospital to help us solve the problems there? So that was how come I found myself in administration as the Director of Medical Affairs and subsequently the acting CEO of Kolebu Teaching Hospital. So be the one to be looking for solutions to problems. A lot of entrepreneurs find their niche by looking for problems and identifying solutions to these problems. A lot of people have made money by doing so. You don't make your pursuit, your main goal, making money. But the money comes chasing after you because you are doing the right thing and you have identified solutions to peculiar problems. Now, punctuality. In Ghana, in 2018, we are still talking about Ghana Mean Time instead of Greenwich Mean Time. Isn't that true? And we are all guilty, are we not? Oh, there are people here who are always punctual. Yeah? Are you always punctual? You know, I believe that being punctual shows that you respect the people you are going to be with. If you are organizing a function and you give a time as 10 a.m., and at 10 a.m., even you, the organizers, are not organized and ready. And people start strolling in at 10:30, 11, 12, and they still think it's all right. It just shows, and those who came early are what? They are punished for coming early, not so. Because they have to wait for everybody else before the function can start. To me, that shows gross disrespect for people. If you respected me and respected my time, you would make sure that we are all on time. If you invite me for a function, because I respect you, I will go there at the time you have assigned. If your lectures are supposed to start at 8, you don't saunter in at 8:15 or 8:30. So being punctual is one of the things that will move you very far in life. Having integrity, that means People can believe what you say, and you will always be doing the right things, irrespective of what happens. In Ghana, when somebody does wrong, what happens? Everybody and his mother goes to beg, not so, and his chief, and his pastor. They go and beg, isn't that so? And then you are supposed to put a human face. This terminology, I don't know why we went and adopted it, but human face. So which one is the inhuman face? The one where the person has done wrong, or you who are trying to make sure that the right thing is done? You know, I don't know what I can say, but if you always want to be with the majority, please note, the majority is not always right. You must not be afraid to be counted with the minority, so long as you are doing the right thing. You should not be a people pleaser. Don't do things because you want to please people. Don't forget, ultimately, the one we have to answer to is God, right? So he must be the one we must seek to please, not human beings. If in seeking to please God, it also pleases human beings, that's fine, but that is not your ultimate. So being known as a person with integrity is really, really crucial. You must be prepared to go the extra mile. Okay? When you move to university, the way our educational system has gone has unfortunately moved or been geared towards chew and paw and what? Okay, chew, paw, pass, and aha. That one is inevitable. If you chew, paw, pass, to pass, you will forget. The way we teach our students is not the best way. Really, everything in life is based on principles. And we need to get you to understand the principles so that you can apply those principles to any kind of situation or equation or question or problem, and be sure that if you follow the same pathway, you will get the right results. Rather than chewing one particular way and that is the only way. So as soon as the question is turned a little bit, you are lost. And that is why you go chasing after past questions. Past questions. Past questions. At the Accra College of Medicine, we don't have past questions. Because you're not supposed to learn the questions and the answers. You're supposed to understand the principles and use those to solve new questions and new problems that arise. So make yourself one of the people who will learn the principles as you go through. There are principles in living life all the way. Learn those principles, and you will be able to apply the solutions everywhere else. Then we talk about, maybe I'll finish off here, the attitudes, our attitudes. I'm sure you've heard this saying that your attitude determines your altitude. How you see things, how you react to things, what you do is what is going to determine how far you go. How many of you would be proud to invite me from here to go to their rooms at home to see how it is like? Nobody. Nobody will invite me to your home. Or even your living room. or even your compound. Why not? Why wouldn't you invite me? Yes? You would invite me. All right, I'll come with you. But I want one of the students to invite me. Anybody who would invite me? What is it about your home that would not make you proud to invite somebody in? That is a function of your attitude. Are you the kind of person who, they give you bottles here. You take off the lid, the plastic lid, and what do you do with it? You drop it, right? How many of you, if you were in a trotro and you bought sachet water, would just put your hand through the window and bah! Ghanaians, a lot of Ghanaians don't see anything wrong with that. When you ask them, what do they say? Zoom Lion is employed to sweep, right? But if everybody was keeping their little bit of rubbish and was putting it in a designated bin, Zoom Lion would not need to employ so many people. The government of Ghana could save money, which could go to improving the infrastructure in your schools. We are all responsible collectively for what happens in our nation. Our attitudes are determining the altitude. And Ghana, you can't say right now, has a good altitude. When it comes to so many things, we are so lacking and so down. And ultimately, it is your attitude that will speak the loudest about you. Your attitude will speak the loudest about you. So, what is the attitude, your attitude, going to say about you? How is your attitude going to determine how far you will rise? If your attitude is one of, okay, we have a test for tomorrow, I can wait. Day before, I will study. It will show ultimately that you are a last-minute person. If your attitude is one of consistency, I will do a little bit every day, and I keep adding on it, you will be the one who will move the furthest because you are consistent and persistent. The Accra College of Medicine is 3 years old this year, and we have clinical students. We train doctors. We have clinical students who are at level 400. That means the first batch of our students will graduate in 2020, 2 more years. And the core values that we have are centered around something we call heart power. Heart power. And having heart power is, again, an attitude where you, as the physician, is committed to putting your patient first. So you do everything you can to ensure that the patient's needs are met when they meet you. You have the right smile on your face. You have a greeting in their language. You allow them to talk. You allow them to express their opinion. You inform them about their condition. And you discuss with them how that condition can best be managed. When you give them medication, you explain to them what the side effects and what possible alternatives to that mode of treatment is. So heart power for whatever you do is what is going to take you the furthest in your profession. So I just want to encourage you that there's still time to make changes all the time. When you hear something and you feel that it's something that speaks to you, you can make the changes that will allow you achieve those hairy, big, audacious dreams that God is giving you. Don't be afraid to dream them. And may God be with you.
Thank you very much, Professor. I've just been informed that the Accra College of Medicine awarded the finalist of last year, Brighter Siedu from St. Thomas Aquinas, a scholarship to pursue medicine at the Accra College of Medicine. And they are doing that again this year. Another round of applause for her, ladies and gentlemen. It is time to dream. Maybe you are the one who will get a scholarship this year. So dream. Let it be big, let it be hairy, let it be audacious. Any questions for Professor Hesse this morning? If you have any question, just raise your hand and production assistants will bring a mic to you to ask your question. Do we have any questions?
Yes. Good morning.
Good morning.
Please, I want you to talk more about pediatrics.
Pediatrics, okay.
Okay, maybe I can start with that whilst others are thinking about what to ask. Pediatrics is the discipline in medicine which deals with children and children's diseases. So it covers everything for the children from the time in the womb during pregnancy up to about 13 years of age. So all the conditions to do with illness, malformations, abnormalities, and so on in children. Pediatric surgery. The training for pediatric surgery, you have to train as a general surgeon. So you learn how to do general surgery. But then you do an additional specialization in pediatric surgery, which deals with surgical conditions of the baby from the time of children, from the time in the womb up till the age of 13. There's a special field in pediatric surgery called fetal surgery, where if abnormalities are detected early whilst the baby is in the mother's womb, the baby can be removed from the mother's womb, still holding on to the placenta. The abnormality can be corrected and the baby put back for the rest of the duration of pregnancy. And these are some of the recent advances that are happening within that scope.
Any other question, please? Any other questions? Okay. So if there are no questions, Prof, I'd like you to give your final words, and then...
Just to say that you mustn't let anything stop you. You may not necessarily want to do medicine, but whatever field you are, I try to give general principles that can apply whichever field you wish to go into. So remember that ultimately the one we have to answer to is God. And make sure that God can say to each and every one of us, well done, good and faithful servant.
Thank you very much, Professor. Thank you. Thank you. Thank you. My takeaway for this morning, yes, dream. But she also added that be persistent, keep at it. It is when you give up trying, that is when you have failed. Thank you again, ladies and gentlemen, for joining our mentorship session this morning. It is proudly brought to us by Bond Savings and Loans and RMG Ghana Limited. Tomorrow morning, God willing, we'll see you again. Thank you.